Good evening. Good evening and welcome to another exciting edition of the Monday evening lecture series. And we hope you've had a wonderful, enjoyable, yet blessed day. And as we continue our proceedings, we would ask Sister Ingrid Moore to lead us in prayer. Sister Moore. Can we bow? Heavenly Father, as we come before you, we'd like you to bless these proceedings. Allow our minds and hearts to open as this information is imparted upon us. In Jesus' name we pray. Amen. This evening, before our presentation, we would like Sister Archer to just bless us for a minute or two with her triumph, her triumph over heart disease, and how 1 year ago she wasn't in a place where she is today. Sister Archer.
Good evening, everybody. Can everyone hear me?
Yes, we can hear you, Sister Archer.
Okay. I think this is an excellent opportunity for me to share my experience that started last year. A year ago, I went to Virginia to take care of my grandbaby for a few weeks. And while I was there, actually before I went there, I wasn't feeling good, but I didn't take too much note of it. I have diabetes, and I just was thinking I was getting tired and whatever because of that. Then I have a little sinus problem going on that I was taking some medication for. When I went to my daughter, I was led to purchase a blood pressure heart pulse device, a blood pressure machine. And I just, I don't have any problem with blood pressure at all, but I just figured it was something good to have on hand and just check randomly. And when I got it, I checked my blood pressure and I said to my daughter, who is a nurse, by the way, who is a nurse. I said to her, I said, oh, my pressure is, and I gave her the numbers, and she said, oh, that sounds good. And then I say, oh, and the pulse is saying 30, it was 30 something. And she was like, oh, mommy, that's not good. And, she was like, that's not good. You almost like the Walking Dead. But I said, I could be okay. I could wait till I go home and I guess her being a nurse training, she didn't want to alarm me on how grave my condition was. So she didn't try to make too much of it. She just probably gently, So the next day, she was supposed to go out to do something fun. I said, let's go do what you have to do first before we go to the clinic. I said to her, no. I said, we may wait till you finish. She said, no, mommy, you have to go to the clinic because it's right around the corner. We went to urgent care clinic. And once I got there, their preliminary examinations revealed that I had a serious condition. And they started getting me prepped and getting me ready to go in the ambulance and send me to the emergency room. And I was very confused and fearful, anxious, and I guess it started a little crying and whatever. But once I got into the ambulance, the technician, the EMS technician, was so gentle, and he spoke very soothingly and comforting, and he said, you could be okay, you guys seem worse than this, you could be all right. And right away, I began to calm down and be, and I said, you know what, I say, in my mind, I was saying, well, God must have sent this EMS person now to calm me down and assure me that he is with me. And from then on, my experience after that, going to the emergency room and they get me prepped and they put a thing on me, on my chest and my back. And as they took me into the intensive care unit and they started running a lot of tests and all of that. But by that time I was with them and I just said to myself, God, everything is in your hand. And I was very peaceful after that. I didn't worry about it anymore. And after they did all sorts of tests, and that was the 7th of June last year that I was admitted. And after doing tests and stuff, they said, you have a problem with the electrical part of your heart, and you definitely will have to have a pacemaker. And I went in to have the surgery and everything. And to God be the glory, great things he has done. I was in the right place at the right time, and I got the pacemaker, and I felt and still feel excellent since that time. And I must say that with heart, our conditions, whenever we feel something wrong with our bodies or we don't feel well, we need to take note of it. And because as the scripture here that's on this flyer says in 3 John 1 and 2, it says, all things be in good health, just as your soul prosper. So I pray that this testimony would be of some blessing to someone here in this forum, and that we would take care of ourselves and take note of when we don't feel well. And, because I had no idea that I had a heart condition. I know I have diabetes, but I had no idea I had a problem with my heart. But I am well, and praise be to God. Thank you.
Thank you very much, Sister Archer, for that timely and very encouraging testimony. Without further ado, I'd like to introduce our speaker this evening, who is a vascular surgeon by profession, a husband, a father, a business owner, but more importantly, with his skills, his talents, and his gifts, he has the ability to bring back life, more or less. And I introduce to you Dr. Delton Farquharson, vascular surgeon. Dr. Farquharson.
Good evening, everyone. First, just let me say thank you to the organizing committee of the Community Services Department of Good News Church, Good News SDA Church. I count it a privilege to be called upon to present this talk tonight. Tonight, we're going to be talking about heart disease, diabetes, and stroke. And we're going to focus a little bit on treatment and prevention. And we're going to touch a little bit on other things. Just of note, I have no conflict of interest with respect to this talk. And the objectives I hope to achieve tonight is that for all of us to have a better understanding of heart disease, diabetes, and stroke. You have a better understanding of how heart disease, diabetes, and stroke are related and how they are linked. I want us to be able to recognize the factors that are present for developing these conditions. And I want us to be able to recognize the symptoms for these conditions, particularly, and what we can do to help someone who we think have these conditions. And finally, I hope we can have a better understanding of the methods of prevention and the treatments of these conditions. Now, as I go through the talk, we have moments or spaces for question and answering. So please indicate by raising your hands. So by way of introduction, heart disease, when we talk about heart disease, we think about coronary artery disease, arrhythmias, like Ms. Archer described, valvular heart disease, and heart failure. And so this diagram of the heart shows basically that heart disease affects the blood vessels. You can see these are the blood vessels of the heart here. We call them the coronary arteries. The arrhythmias happen because the heart has an electrical conducting system where impulses are sent from the SA node throughout the entire muscles of the heart so the heart can beat synchronous. And when those impulses are interfered with, we have abnormal rhythms, and this can cause us to have some bad problems. When the heart muscles are damaged, it will result in heart failure. And then the heart have valves at many junctions. The valves occur between the ventricles and the atrium, and between the ventricles and the blood vessels. And these allow the heart to pump out adequate or sequential amount of volume of blood with each heartbeat. With respect to diabetes, diabetes itself is a disease or condition where you have interference with the metabolism of energy. For us, energy comes from the food we eat. And if we have too much of any particular type of energy, we have problems with this metabolism. And diabetes itself is abnormalities in the way that metabolism function. Now, there are usually two types of diabetes. There's type 1 diabetes and type 2 diabetes. And these are the main two types of diabetes that we recognize today. I'm going to explain these a little bit later. And then we have gestational diabetes. Gestational diabetes is related to diabetes that occur because a female gets pregnant and the diabetes develop because of that. Something that usually goes away. This diagram depicts what actually happens in diabetes. The top diagram shows that the pancreas is responsible for producing insulin, and this insulin is responsible for getting glucose that circulates in the blood from dietary intake into the cell to do what it needs to do. There's an insulin receptor that actually turns on the cell that allows the cell to put the glucose inside of it. Now, when we have type 1 diabetes, there's a complete failure of the pancreas to produce this insulin. And you see these usually in early childhood years when insulin cannot be produced. And what happens is the glucose that floats around in the blood cannot be taken into the cell. And this is where our metabolism goes awoke. Type 2 diabetes, on the other hand, is the pancreas is able to produce some insulin, but it's unable to sufficiently produce insulin to utilize all the glucose that floats around into the blood after we have a meal. The insulin receptors sometimes can be affected. They can be turned on or they can be down regulated because of this. And so the effect of insulin on the cell result in the cell not being able to respond appropriately. Stroke, on the other hand, is considered like a heart attack, a brain attack. The brain is deprived of oxygen and nutrients for a period of time, and this results in the damage to the brain itself. Now, there is a ischemic stroke where oxygen alone is, and the nutrients is deprived from getting to the brain. There is hemorrhagic stroke where you have a break in the blood vessel and you have bleeding. And because of this bleeding, oxygen and nutrients are not able to get to the brain itself, but you have blood going in places that it shouldn't go. And then you have what we call a transient stroke. Some people call this a mild stroke or mini stroke. Transient stroke just lasts for a short period of time. And most times people have a full recovery. This diagram depicts the two different types of strokes. You have a hemorrhagic stroke on your left, where you have a break in the blood vessel and you have blood coming out into the substance of the brain. And on the right, you have an ischemic stroke where you have a blockage in the vessel and there's no passage of blood beyond that blockage. So we have a point here for questions.
Okay, for anyone who has questions, as indicated, you can look to the bottom of your screen, go to participants, and feel free to raise your hand, or you can type your questions in the chat.
Joy, go ahead, ask a question.
You'll have to unmute your mic.
Okay, good evening. With reference to the COVID-19, you can hear me?
Yes.
Okay, I was in the food store and I had my mask on, and I realized that I couldn't hardly breathe with it. I know it was one of the cloth masks, but I felt this like a little weird pain like in my chest area, and as soon as I took the mask off, I was able to breathe properly and the airflow. I almost felt like I was going to pass out. Is that with reference to you talking about the air with the brain stroke? Does that have anything to do with it, with the mask being healthy and you're being able to breathe?
Well, that's not usually that's not a typical question of a stroke. But we can answer that a little bit later. When you look at some of the symptoms as we go through, you'll get a better answer on the strokes, okay?
Okay, thank you.
Okay, no problem. All right, any other question?
Yes, Dr. Farquharson, we have a few questions in the chat.
Okay.
First is, can a person live a normal life after a stroke?
Well, we always hear about the new normal. Remember, there are three different types of strokes. Most times, people who have transient strokes, they can have full recovery, and they usually can go on to lead a normal life. Patients who have ischemic stroke or a hemorrhagic stroke, what is normal depends on how much brain damage occurs at the time of the injury or the time of the stroke, and sometimes people they have to adapt to a new level of normal, but some people can actually still recover, have some good recovery from time to time. But most strokes are devastating.
Okay, our second question is, are there other conditions other than heart disease that might cause a continuous low pulse of around 40 to 50?
Yes, we call that bradycardia, and there are conditions that can cause bradycardia. A lot of them can be related to, well, it depends on a lot of things, because if you are a well-oiled machine or athlete, you may have a low pulse, because if you know most marathon runners, their pulse can run as low as 30. And so that's a natural condition. So the more you exercise and the more endurance that you have, the lower your pulse will be. Your heart will be much more efficient and beat more efficiently. But you have conditions, you have pathological conditions that actually can cause your heart to beat slow. And they're not the topic, cannot be addressed in the topic that we have today, but certainly there are other conditions that can cause your heart to beat slow.
Someone is asking about being diagnosed with arrhythmia. Are you able to get rid of that?
So arrhythmia is an abnormality in the electrical conduction of the heart, and sometimes they can be treated with medication, and other times they can be treated with procedures. So it depends on what it is, and the answer is yes, you can get rid of arrhythmias.
Okay. Can you have a stroke even though your blood pressure may be normal? Normal being 125 to 130 over 60 to 80?
Yes. Hopefully further in the discussion, you will see that there are other reasons that you can get stroke other than high blood pressure.
Okay. Would you like to continue at this time and then take the other questions after?
Okay, certainly. Thank you.
May I interject? Sister Archer has her hand, but because of her role in the meeting, she's not able to raise her hand, but she has a question.
Okay.
Hi, Dr. Farquharson. One of the things that thinking back, that I had noticed thinking back, whenever I had bend down to pick something or bend down to do something, I noticed my head would feel really, really funny. And I don't know if that was because of not getting the oxygen that I needed, because my heart wasn't operating the way that it should. Maybe the flow of blood, I don't know. I just used to have this strange feeling in my head whenever I bend down to do something.
Well, Ms. Archer, there could be several reasons for that. And I think one of the things is blood pressure is a function of position, is also a function. So if you lie down and get up, the blood pressure ought to change, okay? And so if you bend over, the blood pressure will change. And so the blood pressure changes from moment to moment. And so when you bend down, you may have a period before the bodies or the chemicals in the head and neck react to their change in position, and so that will cause you some symptoms.
What I did notice that after I had this pacemaker put in, I don't have that problem anymore.
Exactly, and so that's because your body wasn't able to change the pressure relative to the position that you change. Like I say, your body can adjust its pressure on a moment's notice. But if you have some problem and you cannot do it, then you will have symptoms of dizziness, lightheadedness, and sometimes people even black out.
Thank you.
Okay. Good.
Okay, Dr. Farquharson, just bear with us a moment. We have one or two more questions, and then a hand is raised in the chat. just before we move on. Okay. There's a comment in reference to each ailment. I'm interested in prevention firstly and treatment as it relates to all of the above. And what causes fluttering or beating in your throat?
All right, so we're gonna as we move on, you will get a little bit more on prevention. Whoever's asking that question, and we'll get to prevention later on at close to the end of the talk. In terms of the fluttering in the throat, fluttering it could be is usually a transmission of sound, or it can be a transmission of blood flow. Unless you are seen and assessed by a physician, it's hard to determine just by the question alone, what are you trying to achieve? Okay.
Okay. We have Naomi Bonnaby with a hand raised. You can unmute and ask your question.
And what I want to find out is what really causes high blood pressure?
Okay, so high blood pressure, for the most part, is considered something that is essential. What it means is that we have things that happen within us, within our families, within our environment that causes us to have high blood pressure. The risk factors for high blood pressure are similar to many of the risk factors that we'll be discussing tonight. And so as we go through the talk, I hope you this question will be answered clearer for you, because you will see that many of the there are so many similarities in the things that we're discussing tonight, and these will relate to high blood pressure also.
Okay, thank you.
You're welcome.
Okay, the final question before we move on, and I know there's so many questions that persons would like to ask with these topics.
Shallow speak, I can't.
Can you live a normal life with a leaking valve?
Speak shallow. I on the Zoom talk zone. Don't I on the Zoom? Okay, sorry for that. So when we think about heart disease and we think about blood vessel disease, we put these two together and we have what we call cardiovascular disease, and they function almost interchangeably because of the similarities that each one have. And when we talk about cardiovascular disease, we think about dysfunctional conditions of the heart and the blood vessels that supply oxygen to the life or the vital areas of the body. So cardiovascular disease include heart attacks or heart disease. It includes chest pain, it includes strokes, it includes peripheral arterial disease, poor circulation, it includes kidney disease, it includes all the vital structures or organs of the body. And so hence this big category, cardiovascular disease. And that is why a lot of what we speak tonight, or what we speak to tonight, are so linked, and they're so interchangeable. Because sometimes we talk about cardiovascular disease, and sometimes we mean heart disease, or sometimes we talk about cardiovascular disease and we mean stroke, because there's so many similarities, there's so much common denominators with these things that sometimes all the lines get blurred when we talk about cardiovascular disease. And so stroke, heart disease, and diabetes, they are all linked by one common denominator. And that common denominator is something called atherosclerosis. This is what we call hardening of the arteries. Hardening of the arteries happen, one, because of age. We get older. As we get older, our bodies degenerate. And so the blood vessels get hard. They get harder. They get less pliable. Okay? Atherosclerosis happens because of high blood pressure. So the harder the arteries get, the less likely it is to be compliant, to move around or to stretch. And because it's difficult to stretch, you require more pressure to stretch those blood vessels. And so people develop high blood pressure because of this hardening of the arteries. Diabetes. Diabetes is up there in the top left corner. Diabetes actually, in terms of a condition, diabetes accelerates or cause atherosclerosis to happen much faster than in a patient who have diabetes than one who don't have diabetes. And that's simply because you have all of this energy that's floating around inside the blood, and we don't have the insulin, or we don't have the mechanisms to utilize the energy. And so the body converts this energy into fat. And the first thing it does is deposits it into the lining of the blood vessels. These fat deposits in the blood vessel, they over time, they connect with calcium and they become hard, and that's what caused the blood vessel to be hardened. And we talk about the other link between atherosclerosis and all these diseases is the effect of cigarette smoking. And cigarette smoking also causes hardening of the arteries by a similar methodology or mechanism with diabetes. And so you have deposits of fat into the lining of the blood vessels, and eventually you end up with hardening of the arteries. So cardiovascular disease is very important because it's the #1 cause of death around the world. 31% of the people who die in the world die from heart disease or cardiovascular disease. And you can imagine that 1 in every 3 dead in the US in 2016 was related to cardiovascular disease. If you look at the statistics, even though it's a little old, it holds true for today. The #1 cause of death in the United States is cardiovascular disease. You put all the cardiovascular disease together, we're talking about diabetes, hypertension, heart disease, we're talking about strokes, or you put all of them together, it still remains the #1 cause of death, and it causes more death than all the cancers, all the injuries, all the pulmonary disease, all the infections, AIDS, suicide, homicides. You still don't reach the amount of people who die from cardiovascular disease. So cardiovascular disease is very, very important, and we need to be talking about it more and more and more. This chart depicts that sometime in the early 1980s, it was a trend, and this is a significant trend. The trend was that men were getting less cardiovascular disease and women were getting more cardiovascular disease. And this trend continues. And this led to the Go Red for Women movement back in the early 2000s, where we focus on heart disease in women because it actually became an epidemic across every country. This is some statistics from the United States again. It shows that in 2001, there were about 61 million Americans with cardiovascular disease, and 52% of those people were women. Okay. If you look at this estimate by age back in between 1988 and 1984, you can see that the trend as you get older, you have more females, particularly after the age of 65, you're getting more heart disease or cardiovascular disease than men. If you look at women who die of heart disease versus women who die of cancer, you can see, you know, this blue line, the top line is heart disease, and you have stroke, and then you have lung cancer, which is the #1 cancer in the world, followed by breast cancer. And you can see how far below the death rate is compared to heart disease, just for lung cancer, breast cancer, colon cancer, and endometrial cancer in women. These two, the heart disease and the stroke, outstrip the other cancers by far. So what is the problem at home? What are we looking at home? We have a population of just over 370,000 people. And almost 50% of our population is between the ages of 30 and 70 years of age. The life expectancy has increased in 2015. It's 74.7 years for males and 79.1 years for females. We have a decreasing birth rate as of statistics of 2015. In 2005, we shown that the obesity rate in the Bahamas was about 70%. By 2017, we had an obesity rate of about 80%, and that is less than 20 years. In our region, obesity and overweight is on the rise in every single Latin American and Caribbean country except for Haiti. I don't know why, but certainly Latin America and the Caribbean accounts for about 360 million people that are overweight or obese. But the highest rate is observed in the Bahamas. That's some food for us, something for us to think about. Any questions on that?
Dr. Farquharson, we do have a question that is in reference to a leaking valve.
Yes.
Can one live a normal life?
The answer is yes, and the answer is no. It depends on which valve is leaking. There are 4 main valves in the heart, and depending on how much the leak is or how bad the leak is, you can actually live a normal life. But for the most part, the leakage on the left side of the heart is worse than the leakage on the right side of the heart, and those ought to be addressed.
Thank you. We also have Stephen Johnson. You have your hand raised. You feel free to unmute your mic.
No,
and then Jacqueline Forbes after.
I'm trying to lower my hand. No question.
No question? Jacqueline Forbes, then
Okay,
Michael Smith.
I just wanted to make a comment in regards to Dr. Farquharson's last comment and presentation in regards to he would have indicated that throughout the Latin American region and the Caribbean region, it appears as if Haiti is one of those countries that doesn't have as much, I guess, patients or persons who are suffering from cardiovascular diseases. Is it possible, because not only with Haiti being one of the poorest countries in the region, which would speak for the fact that possibly they're eating less processed food and more from the earth, whereas you have in the Latin American countries and the more, I guess, more developed countries in the region, we are still eating far too much processed food, which probably speaks to why our increase in cardiovascular diseases. Could that be a possibility that they're eating still more from the ground?
Well, the report speaks to obesity and does not speak to cardiovascular disease. So that's one thing. And certainly all the factors that you raise are possible, but I don't think that they can be addressed in a single question because there are so many factors that go into diet. And how it relates to cardiovascular disease. So it's hard to address that with just diet alone.
Okay.
Or availability of processed food alone. Say again?
Possibly then in terms of the obesity, because they're probably eating a more balanced meal because the food is, I guess, to some degree more organic. It's coming from the earth as opposed to having food that is more processed.
Well, again, that's a whole lot of assumptions, but it's possible.
Yes. Thank you.
We have Michael Smith next with a question.
Yeah, I'm a 71-year-old male, and I remember as a little boy, obese persons were a rarity in the community. We ate basically from the soil. We had very little processed food, like all the Kentucky Fried Chicken and all the other stuff. So, and when I look around now, a slim person is almost a rarity. So that tells me that something has gone wrong in our diet. And if you look at what Bahamas eat now, we never ate like that. Growing up, we had very little meat. We had fish. We had rice. We ate stuff that was grown in the yard and all the other stuff. So surely diet must play a prominent part in what we see now as far as obesity is concerned. What do you say?
Well, certainly, I agree with you. Diet is very important. And as we go through this talk, you'll see how it links and how important it is to these conditions.
Next, my mom passed at the age of 49 from heart disease. I exercise regularly, but what is the likelihood of, or the possibility of heart disease for me?
Well, the one thing we can do is we can choose our families. And so all of these conditions have a family component, whether it's genetic or just phenotypic. There certainly is some relation to the family. And so the more prevalent these conditions are in the family, the more likely you are to develop them. But you actually can do things to mitigate against these.
Okay. 80% obesity is something you noted. A question is asked, which standard should we go by for ideal weight? When we look at the ones online, we always see, they're saying it's not for the Bahamas, but what would be the ideal BMI? What can we do to become healthy?
Well, hopefully by the end of this talk, we can have a better idea of what we can do to be healthy. Certainly 80% obesity is very high. And these are statistics from the Pan American Health Organization that the Bahamas government sent to PAHO. These are true statistics, and these are and this is what we do now. In terms of ideal body weight, the ideal body weight is actually dependent on several factors. It depends on your weight, it depends on your height, and so these things come into play. We always talk about, oh, I have heavy bones. There's no such thing as heavy bones. You know, the ideal body weight, we don't want you to be have a BMI of 20, but certainly a BMI of 30 is bad. And 30 is a cutoff that we use for obesity. And certainly, on the other hand, on the lower end, 20 is a cutoff on the lower end. So you people can be underweight and not be healthy, and they could be overweight and not be healthy.
Interesting facts. Yes. Is there a way to check potassium levels without having to go to the lab? And also, does NHI offer a full blood workup culture?
Well, certainly the problem with potassium levels is that most of the potassium in our body is inside the cell itself. And so what we measure usually is in relation to what is circulating in the blood. But the true potassium level is difficult to check, and it can be done experimentally, but nobody does it because the majority of the potassium is needed inside the cell and not outside the cell. With respect to NHI, I'm not 100% sure. I know there is an NHI program for primary care. I am not a primary care physician, so I can't speak to what they offer for that.
Okay, thank you. All right, we will reserve the other questions for your next segment.
Okay, wonderful. All right, so as we move on, we can look at some risk factors for these three conditions. Remember, we're talking about cardiovascular disease now because we have shown that stroke, heart disease, and diabetes have a lot of things in common. And so all the things that we talk about is going to be related to all of those things. And so the risk factors for the three of those are basically the same. So cigarette smoking is probably the greatest risk factor for developing these problems. And we always talk about secondary smoking or passive smoking, and these two contribute. If you smoke, more than likely you increase your risk of developing this problem by almost fourfold. People who have high cholesterol increase your risk about 2 to 2.5 times of developing these conditions. High blood pressure, and we have new definitions for high blood pressure, but we still use the old definition of 140/90, the systolic pressure, the top number being 140 and the bottom number being 90. So if you have a pressure that is above this, then you are hypertensive, or you should be treated for hypertension. People who have low HDL cholesterol. HDL cholesterol is what we call good cholesterol. And if your good cholesterol is low, this increases your risk for developing heart disease and stroke. Someone asked me earlier about family history. So family history, if you have a family history of premature cardiovascular disease, if you have a male in the first degree relative who had this problem at an age less than 55, then your risk is increased. If you have a female first degree relative who had this problem and their age was less than 65, your risk increases. Okay? If you are getting older, then your risk as you get older increases. Men risks start to go as low as 45, and for women that starts 10 years later at 55. Some other risk factors, obesity. We talk about the impact of obesity, okay? And we define obesity as having a BMI of greater than or equal to 30, okay? So between 25 and 30, you know, you could work on that, but anything over 30, you have a problem. We also talk about the hip to waist ratio. In other words, if your abdomen, if your belly is bigger than your hips, you have a problem. Okay? Physical inactivity. Most people recognize that we have become a society where we don't do things anymore, and so because of our inactivity, this contributes to us not. This contributes to obesity, and this also contributes to us developing heart disease or getting a stroke or even getting diabetes. This is a study done that look at the development of obesity relative to cardiovascular disease over a 14-year period, and this study was done in nurses. And on the y-axis, you see the risk. On the bottom axis, you see the BMI. And you see as the BMI increases, the risk for developing these cardiovascular disease increase. And so if your BMI is greater than 29, your risk for developing a cardiovascular problem is almost 3.5 times that above normal. For women of color in particular, there's something called Syndrome X. Syndrome X is a combination of hypertension, glucose intolerance, and hyperlipidemia or dyslipidemia. And so your blood pressure is high, your diabetes is borderline, and your lipids is out of control. We call this Syndrome X. And this is more of a problem in women of color than in their Caucasian counterparts. And this is associated by a higher degree of cardiovascular mortality. All people die when they have this combination. And it's synergistic because the three of these things together, hypertension, poor glucose intolerance, and poor cholesterol control, leads to hardening of the arteries or atherogenesis. And again, this is saying more in women of color than in any other ethnic group. The risk factors for heart disease for men We talk about smoking, diabetes, high blood cholesterol, high blood pressure, obesity, and sedentary lifestyle. And that goes for both men and women. But women have a particular increased risk when they reach menopause. And then for those who are younger, who take birth control pills in combination with cigarette smoking. And these are some of the changes that happen in menopause. The cholesterol, the good cholesterol tends to go down, and the total cholesterol tends to go up. And this helps the development of atherosclerosis. The hypertension, as you get older, you're more likely to develop high blood pressure. And because of this, you develop what we call a metabolic syndrome. This is similar to syndrome X. You look at the risk factors, patients who have diabetes or triglycerides and diabetes increase, the obesity increase in older age. You see the waist circumference increases in old age. And so menopause for the most part adds an additional risk for women over the age of menopause. This chart shows that women who have heart disease, or this shows the menopausal status of risk for coronary artery disease before menopause and after menopause, and you can see the different age groups. And even though you rarely see heart problems before menopause in the young age group, you see quite a bit of it after menopause. This is a Women Health Initiative study, and this Women Health Initiative study showed that even in women who went into menopause and try and replace their hormones, this was not beneficial to them. It shows that when you start replacing your hormones with estrogen plus progesterone, your heart attack rate increases, your breast cancer risk rate increases, you're twice as likely to develop blood clots, and you have 41% increased risk of having strokes. Certainly there's a benefit in terms of hip fractures and not getting colon cancer or cancer of the uterine lining. If you take estrogen alone, then the risk of developing stroke increases, dementia or memory loss increases, and certainly there's a benefit because you have less likely to get hip fractures. So the most important risk factors for cardiovascular disease is the misperception that coronary artery disease is a man's disease. This disease actually affects more women now than men. And so it's very important for women to understand that they are at increased risk of developing heart disease. Questions?
Yes, Dr. Farquharson, we do have quite a number of questions here. The first would be, can atherosclerosis be reversed and how? And part two to that question, should one with heart challenges due to hypertension be seen by a cardiologist?
Well, let me answer the first part of the question first. Can atherosclerosis be reversed? There was a study done in Scandinavian countries, and this was done with with a statin drug, and it shows some reversal of atherosclerosis in the blood vessels leading to the head and neck. And this was a pretty old study, and a lot of people have challenged it because the results have never been reproduced. But certainly, that was the study that led us to believe that atherosclerosis is reversible. The other study that led us to believe that atherosclerosis, if you look at people who smoke cigarettes, the people who smoke cigarettes, if they continue to smoke, their life expectancy compared to their counterpart who don't smoke is shortened. However, if they start smoking, between 10 and 20 years afterwards, the risk of dying is equal to their counterpart who never smoked. So these are just a few examples of why we think that atherosclerosis is reversible. However, you have to caution you here, because atherosclerosis is a systemic disease. If you have hardening of the arteries in one part of your body, it is more than likely you have it in other parts of your body. And so the changes that may happen, say, in the head and neck may not reflect the changes that may occur in the legs. And we've seen it over and over again, because like in the Bahamas particularly, we don't see much hardening of the arteries in the blood vessels of the neck that goes to the brain. But certainly we see a lot of hardening of the arteries in blood vessels that supply the feet. And even though these patients are on statin drugs, the reversal doesn't seem to pan out in the same way. The second part of the question, should heart changes due to hypertension be seen by a cardiologist? Certainly most internal medicine specialists can monitor or can treat hypertensive disease. And certainly one of the complications of hypertension is hypertensive heart disease. In other words, because your heart have to work so hard against with so high blood pressure and to pump blood to the rest of the body, your heart can develop symptoms that suggest it may be failing. At this time, you should be seen and treated and assessed by a cardiology, or even sooner if your medical doctor determines that you need to be seen.
Thank you. How dangerous is pulmonary hypertension related to sleep apnea? Can it be life-threatening?
Well, pulmonary hypertension and sleep apnea are two different conditions completely. Pulmonary hypertension happens because of someone have blood clot in their lung. One of the reasons is they have blood clot to their lung. And one of the results of that is they can have heart failure. Sleep apnea has to do with blockage of oxygen or that enters the lung, and certainly patients tend to fall asleep and they only wake when the carbon dioxide level reaches a certain level. Now, they can certainly be life-threatening if they happen together, because you have two mechanisms that reduce blood oxygenation. And certainly if you have these conditions, you ought to be treated for them to prevent premature death.
Thank you. What are some of the possible reasons women are now at higher risk? And what is an acceptable LDL cholesterol level?
Well, what I'm going to do is I'm going to leave that first question because I addressed that later on. So
Okay.
hopefully you'll get the answer. If you don't, you can ask the question again. And what is an acceptable level of LDL cholesterol? The latest studies show that LDL cholesterol less than 100 is acceptable. And so most people work to have your LDL, the bad cholesterol, to 100 milligram per deciliter.
Okay. You said you leave the first question for later down.
And the first part of that question
Okay.
will be answered.
All right.
shortly.
So what are your views on sleep apnea and using a mask? Do you think a sleep mask is effective in reducing a stroke?
Well, again, sleep apnea is a little different from stroke. And a lot of studies have linked people who develop sleep apnea and people who develop other problems. They have been linked. But again, it's two different conditions, and they were actually totally different. Like I said, sleep apnea has to do with decreased oxygenation going into the lungs so that you can oxygenate your blood. A stroke has to do with decreased blood oxygen going to a particular part of the brain. Certainly, a sleep mask is effective in reducing sleep apnea, and I can't answer the part on whether it reduces stroke.
Okay, thank you. For a point of clarity, are you saying that some women experience heart conditions post-menopause?
Yes, what the studies have shown is that menopause Women are usually the estrogen and progesterone protects women before menopause. But once menopause occur, they have increased, the menopause itself causes a different type of metabolism of fats and other metabolic processes. And so you have increased rate of deposits of triglycerides and cholesterol. You have increasing cholesterol levels. And so these contribute to developing hardening of the arteries and eventually heart disease. So nowadays, postmenopausal women are more likely to have a heart condition compared to men the same age. And that's what the last study showed, that women are more likely after menopause to have heart disease.
Thank you. How dangerous is a low pulse rate, especially for persons who are active or athletes in particular?
Again, if you're an athlete, if you are a well-trained athlete, you want to have a low pulse rate because that's the efficiency of the heart. It makes the heart more efficient. But if you are not an athlete, if you're not a marathon runner, then a low pulse rate needs to be assessed because it could indicate that you're having a problem, and that problem needs to be addressed by a heart specialist.
Okay, thank you. And our final question before we move on to your next segment is, what can women of menopause do to offset a rise in cholesterol?
Okay, so we'll address that further.
Okay. All right. Thank you.
Okay. All right, so we'll look at some of the warning signs of heart disease. And most times people present with pressure, or a feeling of pressure or burning or squeezing in the center of their chest. We're talking about central chest pain. And sometimes this discomfort could extend to the arm, could extend to the shoulders, can extend to the neck, can extend to the jaw, it can extend to the stomach, it can extend to your back, and sometimes it can even extend to your teeth. Because people have known to present with toothache and end up having heart attacks. Sometimes they can have shortness of breath. They can feel overly tired. They can go into cold sweat, or some people refer to it as dead sweat, and they can have nausea, or they can have weakness. And so these are just some of the traditional signs of heart attack that many of us have heard about this before. We refer to this as chest pain, or sometimes we call it angina. And this angina we refer to as typical, meaning that it's predicted. We know what it is, and this is relieved when we rest, okay? Unfortunately, some women don't have what we call typical angina or typical chest pain. They have atypical chest pain. Sometimes they may just have extreme fatigue, or they may have lightheadedness, or they may just faint. They might have indigestion, or they call it, heartburn or something like that. And, they go take something else. And so these atypical symptoms are mostly seen in women. So some of these symptoms, they differ in men when you think about what's happening in men and women. They are different. All right. So in women, they can have upper back pain instead of a mid back pain. They can have it in the pain referred to their jaw, or they can refer it to the neck. Sometimes they do have shortness of breath, but sometimes they can have flu-like symptoms. They can have nausea, they can have vomiting, or they can have cold sweats. They could even have weakness. So a lot of people get anxious, they can have loss of appetite, or they may just describe this as discomforting. So in women, when you think about the early signs of heart attack, sometimes those signs happen weeks before the heart attack actually happened. And for the women who were in this study in 2003, 95% of the women who give an account said that they had unusual fatigue. They had some sleep disturbance, they had some shortness of breath, they had indigestion, and they had chest pain. At the time that they were having the heart attack, you could see that they wasn't having much of the classical pain. Only about half of them had shortness of breath. Half of them felt weak. Half of them had chest pain. And so this makes it a little challenging to diagnose women, particularly women, when they're having heart attacks. When you think about diabetes and you think about some of the traditional symptoms, this excessive thirst, right? Some people get very, very thirsty. You say, oh, I can drink, you know, a gallon of water every day, and they think that that's good, you know? And some people have frequent urination or even bedwetting on occasion. Some people have excessive hunger. They eat and they can eat and they can eat. Some people have unexplained weakness. Some people have unexplained fatigue, unexplained weight loss. And these are typical, and these can happen. Some people present with blurry vision. They have cuts or injury that heals slowly. Some people get itching and skin infections, particularly fungal infections between the toes. You find some people just get mood swings, or they get headache. And so you have a variety of symptoms that may occur. The similar symptoms may happen in type 2 diabetes. Tiredness, your frequent urination, thirsty, numbness and tingling in the hands and feet. Certainly they have recurrent infections, always feeling hungry, itching. So some of the same things that happen in type 1 diabetes happen in type 2 diabetes. Putting on weight. Putting on weight is important. So why are these important? Particularly why is it important to recognize these problems? Because in diabetes, the longer these things go recognized, the more likely you are to have a complication. The problem with type 2 diabetes is many people are diabetic for years and years and years before they are discovered to be diabetic. And most people who present in our institutions present with a complication of diabetes rather than with symptoms of diabetes. So you'll find people, they come in because they black out. And when you test the sugar, it's very high or it's very low. You have people who present with blindness for the first time. Some people present with kidney disease and have to be on dialysis or have to shortly go on dialysis. A lot of people come with heart disease. Some people come with infected or rotten toes and feet and poor circulation. And so the reason why it's important to understand and to recognize why we need to know the symptoms of diabetes and cardiovascular disease is because we want to prevent complications. So the traditional symptoms of stroke are almost classical. We usually have sudden onset of numbness, or some people have sudden onset of weakness, and this numbness or weakness could be in the face, it could be in the arm, one arm, it could usually be on the leg. What's classical is usually on one side, and all of these things can happen on one side, and it depends on the degree of occlusion or blockage of oxygen going to the brain. So if you have a small area that's been affected, then you may only have a small area affected. If you have a large area, then you might have an entire hemisphere or the whole on one side affected. Some people have sudden onset of confusion, or they have trouble speaking or even responding. Some people have difficulty understanding speech. Sometimes there's sudden blindness in one eye or both eyes, and sometimes this blindness can be temporary, so it's a false sense of security sometimes. Sometimes people just unable to walk, they get dizzy, they get imbalanced, or they lose their coordination. Sometimes people just complain of severe headaches, but the one thing they will tell you is it's the worst headache that they ever had. So what should we do? If you think someone may be having a stroke, and this is very important, I want you to remember this tonight. You have to think fast, and I want you to remember F-A-S-T, fast. Okay, and these are some simple things that you can do to help this person. Face, F is for face. Ask the person to smile. If someone can't smile at you, or you see one side of their face is droop or twisted, that means they may be having a stroke. You ask them to lift their arm. If the patient can raise both arms and one drift down without them keeping both up, they're having a problem. if you ask someone a simple question, or ask them to repeat a simple phrase, and they try to repeat it and the speech is slurred or confusing, they may be having a stroke. And what is most important is the T. You don't have a whole lot of time. What the studies have shown is that people who having a stroke and is recognized within 3 hours and they get to the hospital, they can actually reverse the stroke. 3 hours is the window. And so most people, are found after the fact. Okay, so we like to say, don't waste time. Time is brain. So the more brain you can save, the more likely the person can come back to some semblance of normal. So a lot of us are told, don't worry, be happy. So we have a lot to worry about. Okay, so why should we be worried? So, and I hope this answers some of the questions from an earlier person. Women in high-power jobs are at increased risk of heart disease compared to women who have little control over their work. And we believe that this is stress. We believe that this speaks to the increased level of stress and responsibilities that goes along with high-power jobs. Younger women who have heart attack do not have high levels of fatty plaque clotting the arteries. And so the reason, and this is another thing, because we find that the heart attacks that happen in younger women, it does not correlate with the fact that you need a lot of hardening of the arteries or a lot of blocking of the arteries for these things to happen. Women develop heart disease 10 to 15 years later than men, simply because they lose the cardioprotective effect of the female hormones. When women smoke, it increases the risk of cardiovascular disease more than a man, because it lowers the amount of hormone, or the female hormone estrogen. And we know this is like putting you into menopause. So if you're smoking, and you're smoking in your 20s, 30s, and 40s, you actually pulling yourself closer to menopause, and this increases your risk of developing cardiovascular disease. Women who smoke risk having a heart attack 19 years earlier than women who do not smoke. The other thing that the Women Health Initiative shows, that women don't put their health as a top priority. That's because they have to take care of everybody else in the family before they decide to take care of themselves. Everybody else have to be taken care of before they come to themselves. Sometimes they think that they're not old enough to be at risk, but we just showed that people who smoke early, they tend to lower their risk or increase the risk of developing heart disease or cardiovascular disease. Sometimes they are too busy to make the necessary changes in their life, and this add to the stress, and this add to the risk. And sometimes they don't have the familial and social support to do what's necessary to take care of themselves. So when we look at the women and the men who have heart disease, okay, there's a lower prevalence of myocardial infarction in women. There's more heart failure. There's more chest pain. And the lesions, there's more microvascular dysfunction. In other words, the smaller vessels in the heart tend to be affected more than the larger vessels. And because of this, it makes treating the heart condition actually harder. So women are more likely to die within 1 year after having a heart attack, and they are less likely to survive any type of surgery because the size of their blood vessels, et cetera, are smaller than men. And so even operating on women is a risk. Women are more likely to experience complications after having angioplasty or minimally invasive surgery, and they are more likely to have life-threatening arrhythmias or irregular heartbeats when they develop these problems. So why should we be worried? There are a lot of other reasons why we should be worried. Aspirin does not prevent first heart attacks in healthy women as it does in men. And the studies have shown that women taking aspirin are more likely to not do well. Women are more likely to have a heart attack without having chest pain. They are more likely to die in hospital, and they are less likely to receive the appropriate treatment for their condition. Questions?
Thank you, Dr. Farquharson. I think you did answer the question as it relates to heart disease. So we'll move on to testosterone injections. Does it have an effect on the heart?
Well, I need to find out who's taking it, a man or a woman. Certainly testosterone has the effect of, it has, the hormonal effect is widespread, and certainly it would affect muscles across the spectrum, particularly in men, more so in women. But certainly the testosterone, the injection is different from the endogenous testosterone, that it would have an effect on the heart.
Thank you. What is vasculitis?
So vasculitis is a condition where you have inflammation in the blood vessel. Now that inflammation comes, most times vasculitis is the body creating antibodies that fight itself. And that is the problem. So it is what we call an autoimmune condition. So the body automatically fights itself.
Okay, I'm noting that we did get the answer as to whether it was a male or female. It was actually in reference to a male, the question you answered about testosterone injections. And then we have, is it normal for women to experience frequent heart flutters and palpitations during menopause?
Well, those things are not normal. So if they are frequent, then you need to be seeing a physician and have it assessed properly. It's not normal.
What causes palpitations?
Well, there are several things that can cause palpitation, but if you think about heart disease, you can have a pause in your heartbeat, okay? Or we always talk about your heart skipping a beat. So there are different type of what we call arrhythmias, or different type of heart rhythms that can cause you to have this palpitation. And these are things, again, that ought to be checked if you are experiencing them. It's usually related to heart pausing or speeding up and slowing down without having a regular rhythm.
Thank you. A woman age 86 with frequent heartburn or acid reflux, is that normal?
No, heartburn is not normal unless you eat too much. So it's not normal.
What causes heartburn?
What causes heartburn? Usually heartburn is what we call acid reflux. The esophagus has two mechanisms to keep the gastric juices from coming into the esophagus. The lower esophageal sphincter is supposed to actually work to prevent acid in the stomach from coming into the esophagus. The esophagus lining it cannot tolerate acid, and so every time it comes up, you have a heartburn. And so if you're having frequent heartburns, you have to find out, one, is your heartburn related to acid reflux, something coming from your stomach, or is related to something coming from your heart? Because the symptoms of heart disease can also mimic acid reflux.
Okay, because my father is 92 and he's a diabetic, and sometimes he's talking about acid reflux or heartburn or something like that.
Okay, there are a couple of things. Patients who have long-standing diabetes, they can have the diabetes, the diabetes itself is uncontrolled, can damage the nerves to the stomach itself. And because of that, the stomach can dilate. We call that gastroparesis. And when that happens, the acid can actually sit there, and depending on how we lie down, that acid could actually move into the esophagus and cause him to have repeated heartburns. Again, this is something that needs to be assessed by a physician, his physician, or some other competent physician, so it could be managed appropriately.
Okay, thank you.
Okay, our next question. Can the onset of heart disease be detected via annual examinations or lab tests?
The answer is, if your lab test, annual examinations is almost like a screening. So if you're not having a problem, then your physician may not order the test to look for a problem. Okay, so it depends on a lot of things. Now there's something called an executive physical, where you spend a lot of money and they do a lot of expensive tests. And certainly those tests can actually be a screening for heart disease if you so desire.
Thank you. Please repeat the comment about women versus men taking aspirin.
Okay, all right, let me just go back. So daily aspirin does not prevent the first heart attacks in healthy women as it does in men. All right, so the aspirin doesn't give the same effect for women as it does in men when they have their first heart attack. You know, if someone having chest pain, we actually grab an aspirin and tell them chew it up, and most times that pain is relieved. The same effect doesn't happen in women. I think that's what I'm trying to say.
Is MVP something that can be reversed?
MVP? Well, MVP is a mitral valve prolapse, and what happened is the valve on the left side of the heart, it inverts, and it shouldn't happen. Now there are things that actually cause it, and there's treatment for it, and certainly sometimes it can be reversed with treatment.
Thank you. Would UWI students be able to get a certificate of participation or CME credit for this session from you, Dr. Farquharson?
I don't
Great
know.
presentation, by the way.
No.
It's a comment.
You can tell the students we didn't apply for any CME credits for this. This is a community service.
Why does it take some people a longer time to speak after a stroke?
Well, again, it depends on how much brain is damaged. So it depends on, sometimes the damage could can be to the speech area. It could be to the speech association area, or it could just be swelling to those areas. And so it depends on where the damage is, and that causes that affects the speech.
And that also determines how long they would take to speak,
how long it take to recover.
Whether they would speak after.
Correct.
Okay, thank you. Can certain foods cause acid reflux?
Certainly, yes, they do. Yes. We usually recommend that patients who suffer from acid reflux, they refrain from caffeine and caffeinated products, things like mint or peppermint, spicy foods, sauces, particularly tomato sauces, and those kind of things.
What is recommended for women since aspirin is not the best for a heart attack?
Well, the aspirin relates to the first heart attack, so don't. But there are several other medications that can be used. Certainly, aspirin is good because one is cheap and is readily available. But you have other medications that can be used, and they all by.
Thank you. We have Michael Smith. Unmute your mic and you can ask your question.
Yeah, doctor, I believe you indicated earlier that testosterone replacement therapy can cause heart problem. How so?
Well, certainly, the way testosterone work on the muscle is that it causes hypertrophy. So if you already have, if you are taking it in an unprescribed or unsupervised manner, certain you can actually increase your muscle to the point where you can actually put your heart into failure.
Wow. Okay, so it changes the blood density or something like that.
No, it works on the muscle. It has an effect on the muscle. How the muscle hypertrophy is how the muscles get big.
Okay. And the heart is a muscle.
Pardon?
The heart is a muscle, right?
The heart is a muscle.
Okay. Yeah. Okay. Yeah. I see what you say. Thanks.
Okay, are there any other questions? Feel free to raise your hand or type in the chat. If not, Dr. Farquharson, you can continue.
Okay, good. So let's look at a couple of solutions. So first, I think the biggest thing to this is people need to take charge of your health. People with heart disease are living longer. I mean, we have seen it. We have seen a gradual increase in life expectancy even in the Bahamas. Several years ago, women only lived to 75 years of age. Now women are living to age 79 years in our country. Men didn't reach 70. Now they're reaching age 74. Yes, women will outlive men, but certainly everybody is living longer. And so prevention is still the best cure, particularly for cardiovascular disease and all its related conditions. But I want to speak a word of caution here. You can still do all the right things and you can still develop heart disease because there are so many factors involved in developing cardiovascular disease. Sometimes just understand a healthier life could only cause you to delay the development of heart disease and not necessarily stop you from having it. So we know all of these good, nice, fancy, good tasting food. Are we saying that? Are we saying all these good, fancy stuff? All right. And this book that was written several years ago, Mindless Eating, speaks to why we eat more than we think. And so we're eating more than we actually do. And because all of cardiovascular disease is related to us taking in more energy than we actually need, all of this energy is what causes us to develop these cardiovascular disease. And certainly all these rich foods that you see here, Gorbaduff and chicken wings and cheese sandwich, and potato chips, etc., and cheese, all these rich foods, they put so much energy inside our body that our body is so used to storing energy that it stores it for us in a bad way. And I know this is a little busy slide, but I just want you to see what happens when we take in extra calories. What happens when we take in extra calories? Okay, we increase our insulin resistance. Our insulin can't work the way it should. Okay, we develop high blood pressure because we develop hardening of the arteries. We get obese. We put on weight because we have so much energy. We have high cholesterol. We develop cholesterol because all of that energy have to be stored. The body do not throw away what you give it. If you give me 4,000 calories 3 times a day, all 12,000 calories will be stored. Mind you, sometimes some of us only need 16, 18, 2,000 calories, but we eat 10,000 calories a day. Excess calories will be stored and the body will store it as fat. Okay? And these are some of the things that can develop from this excess calorie, diabetes, obesity, and all these kind of things. So it is important for us to know our risk factors, know what we are at risk. We need to talk to our families and find out who have high blood pressure, who have diabetes, who have this, who have that. You cannot choose your family, so it's best to be aware of what's going on. If you smoke, you need to start smoking. You need to maintain a healthy body weight. We see that an ideal body weight is usually based on your weight and your height. And so, you know, if you're a certain height, then you need to make sure that your weight corresponds to that height. We need to eat well-balanced nutrition meals that's low in saturated fat. We need to monitor blood pressure and diabetes. We need to exercise regularly, limit alcohol intake. We learn how to manage our stress. And number 9 here, something that we don't talk about. You need to have good social relationships. You need to have outlets that you can actually relieve all your stress. And you need to learn the warning signs that we talked about earlier. You need to get moving. Getting moving, exercise improves heart function, lowers blood pressure, lowers blood cholesterol, boosts your energy, right? So we need to exercise more. Housework, scrubbing floors. I mean, all of these things are good. We don't do them anymore, but certainly they're good. All right. For people who are out in the yard, weeding and stooping and bending and all those things, all of those, you burn 230 calories per hour just by doing some gardening. Okay. Nutritious, well-balanced diet is important. This should include fruits and vegetables, grains, fiber, low fat. This is the food pyramid. The things to the bottom that you need to try and avoid, that you need to eat a lot of, and the things to the top are the things that you need to try and avoid. So we need to control our blood pressure. So if we eat poor, we are inactive, then we can end up with high blood pressure. We need to control our blood cholesterol. This goes back to it. You need to eat right, and you need to be active. You need to, diabetes, the same thing. You need to eat right, and you need to be active. Stop smoking, minimize stress. I repeat it over and over and over again because the thing that links all of these conditions is atherosclerosis. Atherosclerosis developed because we take in too much energy. There are some treatment options. They are classified as lifestyle modifications, and so we need to change the way we do things. All right. And there are medications. No one likes to be on medications, but certainly we have a lot of medications that we can use to treat these conditions if you do get it. These medications are not preventative. These are for treatment. We're going to talk about those in a minute. We have surgical options. If you have a problem, we can operate on you. We can operate on your heart. We can operate on your brain. We can operate on your kidneys. We can operate on your legs. We can operate on any part of your body to fix whatever you can. We can even give you gastric bypass, and that helps you reduce your energy consumption. We can do it minimally invasive without actually doing a lot of cutting sometimes. Questions?
Yes, we have several questions for you. Why do doctors recommend a daily dose of 81 milligrams for people diagnosed with diabetes?
Well, as I said earlier, patients with diabetes, they develop hardening of the arteries faster than someone their same age who do not have diabetes. And what hardening of the arteries do is when blood is exposed to collagen, which is the lining of the blood vessel, it forms clots. And what plaque do is plaque destroys the lining and expose the collagen in the blood vessel to the blood, and the blood form blood clots. What aspirin do is aspirin stops the small little particles in the blood called platelets from forming clots. And so this is the reason why most people prescribe aspirin to help prevent clotting, to help the small little particles that start clotting, to stop them from starting clotting.
Thank you. What lab tests should be done with an annual for a female over the age of 50 to prevent most of these illnesses before you have symptoms?
Well, I think those things need to be discussed with your doctor. There's no one particular lab test. There are many tests, and a lot of other factors are involved. And so I think certainly if you have some concerns, you need to raise it with your physician, and they can be audited.
Thank you. What do you do as a female if your doctor continues to recommend aspirin as one of the medications to be taken every day?
Then you
This
take
is
it.
for an 85-year-old.
Yeah, then you take it.
Can type 2 diabetes be reversed?
The quick answer is it is possible. It is possible because type 2 diabetes is related to lifestyle, and you have to change your entire lifestyle in order to reproduce it. Now, understand that sometimes when you start a process, you know, if you were having diabetes from the age of 25 and you didn't find it out until the age of 50, so you had 25 years to catch up. Those 25 years, you're going to have some damage because of the diabetes, and those damages will not be corrected because, right? And sometimes it's so difficult. That is the reason why type 2 diabetes is so difficult to manage, because a lot of patients have it for years and years and years before it is discovered. And because of that, the injury has already happened, and it's hard to reverse things that are already injured in the body.
How long can you take Nexium for acid reflux?
How long? Well, I guess I think what's more the more important question is have all the diagnosis or possible causes for reflux been established, and if there's no other reason for you to have reflux, then certainly it can be. There are some long-term complications that need to be understood, but certainly it can be.
Thank you. Lavette Morris, you can unmute and ask your question.
Hi, good evening. I wanted to know, I've been experiencing heart palpitations for several months now, and it wakes me up out of my sleep. Is there anything that I can do to prevent the frequency of it happening?
Well, I think you need to be seen and assessed by a physician if you have not already done so. If you have and they've prescribed some medication, you need to still see your physician and ask them to optimize the medication that you were prescribed. So it's important that you know why you're having a problem, and then only then can you do things to get it corrected.
Okay, thank you so much.
You're welcome.
What should you do if you get to the hospital with stroke symptoms within the 3-hour critical time, but you don't receive medical attention until after 8 hours? Is stroke considered a priority in our health system?
Yes, stroke is very much a priority in our health system, and I've personally been involved in several cases where patients has had full recovery if they got to the hospital within the 3-hour period. And both hospitals, that's both Doctors Hospital as well as Princess Margaret Hospital, we have the same protocol.
Thank you. After 40, is it advised to do an executive or to do executive exams as to just doing the regular health screening to actually find out what is really going on in both healthy women and those who are diagnosed with HTN and diabetes?
Say it again, sorry.
The question is, do you advise one to do an executive exam or just the regular screening to actually find out what's going on in healthy women versus those who are diagnosed with HTN and diabetes?
Going on.
Well, I think that should be your concern. That should be a concern of you and your doctor. So you could discuss that with your doctor.
Thank you. What causes heart palpitations? Is there anything I can do to help reduce the frequency of it?
Again, you need to see your doctor and find out why you're having it.
What is the life expectancy of women with congestive heart failure?
Well, I know it's reduced. I can't tell you by how much.
Okay. It was suggested that I have a heart test done because of low pulse rate readings, but I've always been super active from a child, playing all sorts of sports. Then after joining the military and continuing the high physical pace, should I be concerned and submit to the testing or leave it alone?
Well, I think you should have that conversation with your doctor. And if you particularly if you're having symptoms, then I think you should subject yourself to the test.
Can congestive heart failure be reversed?
No. You need a transplant.
Transplant. Why do doctors recommend a daily dose of... Okay, just a moment for me. Oh, that was a repeat question. Okay. Why do doctors give a first-time patient with diabetes? Oh, I'll paraphrase. Yeah. Why do doctors recommend a first-time patient with diabetes prescription medication versus natural supplements?
I think the problem is by the time you come to understand that you have diabetes, you've had it for years, and you need treatment.
Oh, just one moment for me. Should one be concerned about a slow heartbeat?
Well, we talked about that already. If you're symptomatic, yes. If you're having symptoms, shortness of breath, palpitations, yes. If not, a regular check with your doctor should suffice.
Okay. Okay, we are at the end of our presentation, and we'll wrap up once we complete this final question and answer segment. Let's see.
Okay,
Yes, go ahead.
All right, I just want to mention a couple of things that research has shown that are not useful. So we talk about hormone therapy, particularly in women. We talk about, and the studies look at vitamin E, vitamin C, and beta carotene, and shown that they are not helpful in cardiovascular disease, as well as folic acid supplementation with or without B12 and B6. These have not been helpful in reducing the cardiovascular events. So in conclusion, heart disease is a leading cause of death at home and abroad. Heart disease, diabetes, and stroke have many things in common. The pathology with atherosclerosis, the risk factors, the symptoms, then the way we investigate it, and certainly the treatment. Prevention of these diseases is crucial to overall well-being. And just remember that 50% of the heart disease problem can be avoided by lifestyle changes, and treatment options are available. Thank you.
Thank you, Dr. Farquharson. We will turn it over to Mr. Philip Paul.
Good evening, and thank you very much, Dr. Farquharson, for your time, your presentation, and it was really informative. And I hope that each and every one of us could walk away with at least one thing we've learned to help to apply to our life, grow, and if needed, use it to save lives. So on behalf of the Community Services Department of Good News, I want to thank you very much for your time as well as the participants and their time. And we'll have closing remarks by either the pastor or someone from the pastoral office. Pastor Basil Stirrup, are you available? If not, Marcia Musgrove, can you provide the benediction as a board member?
Just before the benediction.
You are
yes.
available, Pastor.
Yes.
Okay.
Yes. I was only able to catch the last few minutes of the presentation this evening. My wife took me out for a drive so I could get some fresh air. So today was my best day since my surgery. Let me just say that the presenter tonight is the person who performed my surgery and did an excellent job. And publicly, I'd like to acknowledge him and thank him for doing such a beautiful job. But I have to share this quick testimony before we end. I was a little nervous just before my surgery last Thursday, and I was talking with Dr. Reginald Nemore, who's a family member, 2 days afterwards, and I told him the most beautiful moment of my experience was just before I went into surgery. Dr. Farquharson, I think he sensed that I was a little nervous, and he prayed with me, and there was a peace that I experienced that just made the rest of the surgical procedure and the experience extremely beautiful. And I just want to thank him for praying with me before actually going and performing surgery. In fact, I wrote a letter to the editor of the newspapers to just express how powerful that was, because as a pastor, I prayed several times for people going into surgery, but I've never had anybody pray with me, and it really made a difference. And even now, just thinking about it, it is a bit of an emotional experience for me. So Dr. Farquharson, thank you for not only doing a tremendous presentation this evening, but also thank you for ministering to me in a personal way. I'll never, ever forget that. That moment is just frozen in history for me. So for those persons who were able to benefit from the presentation this evening, I want you to know that you were not just listening to a medical doctor, but you were also listening to a minister of Christ. And I pray that God will continue to bless him in his service to the community and also the ministry that he performs. So, Sister Marcia, I now turn it over to you, and you can give us our benediction.
Thank you so much to everyone who joined us this evening. And if your question was not answered, Dr. Farquharson is willing to hang on for a few more minutes to get those questions after the benediction. So if you didn't have your question answered, you can hang around and we'll try to address those for you. Let's bow where we are, please. Gracious Father in heaven, we just want to thank you so much for knowledge, for wisdom and understanding, Lord. You say in your word that if we get it, it will give us long life and it will give us prosperity. And so, Lord, I ask that you would continue to bless the presenter and bless his hands and his ministry as he partners with you in healing people in our nation. Bless everyone who participated on the call tonight, Lord, and their families, Lord. And I pray that the information that we have learned here tonight will bear good fruit in our lives so that we can be healthy and wealthy. And when we pass from this life, Lord, and we go to heaven with you, when you return, Lord, may we rejoice that we have experienced your blessings here on earth and in living with you forevermore. In Jesus' name we pray. Amen.
Amen. Dr. Farquharson, we do have a few more questions here.
Okay.
Lifestyle changes made has me off medication for type 2 diabetes. Can you control it? But you can control it, but you are a diabetic. Oh, it's a comment rather. As Dr. Farquharson has said, you have to be vigilant and, of course, vigilant with maintenance. So thank you for that word of encouragement for those who are wondering whether it is possible to control any of these concerns discussed tonight. There is
Good
another
evening.
question.
I didn't get the answer from Dr. Farquharson with first-time diabetes and medication instead of natural resources.
Okay, Ms. Camp, as I was saying earlier, by the time you are diagnosed with diabetes, so much time has passed that treatment is your option, should be your only option. Now, I do not discredit holistic, I encourage a holistic approach. I do encourage a holistic approach to any medical treatment. But I like patients to understand, one, that treatment means that you're trying to prevent a problem. And a lot of the holistic remedies are actually for prevention rather than for treatment. So if you have a holistic remedy, sometimes that remedy is usually for prevention rather than for treatment. Diabetes isn't something that can be cured because it is a lifestyle problem. There's so many things that have to be changed. Okay? And as I was saying earlier, the effect of having diabetes for 10 or 15 years before you find it out, the recommendation is that you go on conventional treatment rather than on traditional treatment.
Dr. Farquharson, would you recommend
Thank you. I was
CoQ10?
just finding that out for someone. Thank you so much.
You're welcome. So again, sorry, Ms. Stiles.
Sorry. Would you recommend CoQ10 to help with the heart?
Well, CoQ10 is actually only a cofactor. It isn't actually a treatment. It's a cofactor that helps other things work to make things better. So it is a dietary supplement, and certainly I recommend it if you are able to take it without any complication.
Okay, if there are any more questions, you can indicate by raising your hand or typing the question in the chat. I don't see any more types currently.
I do see a hand from Lavette Morris. Do you have a question, Lavette Morris? Okay, perhaps that was from earlier.
I think so.
Janice Coakley, please unmute and may I ask your question.
Yes, good evening, Dr. Farquharson. Question for you about, you just answered a question about taking the CoQ10 pills. Yes. What are the side effects? Why did you make the statement that you made? Is there some bad side effects to taking that pill?
For CoQ10?
Yes.
Like anything else you put in the body, there's a possibility of side effects. But generally, CoQ10 is a cofactor. In other words, it helps things work better. You understand? So it has no direct effect on a particular condition, but it helps other things that have an effect on the condition work.
Okay, understood. Thank you.
Yes.
I have a question, Dr. Farquharson. How does poor circulation in the legs affect your heart?
All right, there are several. This is a whole topic I could talk about.
Okay.
So, poor circulation means that I suspect that now there are two parts to the circulation. There's a part where blood is going to the legs, and there's a part where blood is returning from the legs. And both of those systems, you could have poor circulation, and both of them could affect your heart.
Okay.
So let's talk about blood going to the legs.
Okay.
The reason blood going to your legs, how it affects your heart, one is because you have hardening of the arteries, sufficient blood is not going down towards the circulation. In other words, you don't have enough oxygen. And so what happens is when you don't have a lot of oxygen, what happens is you have the way your body have to get energy to the muscles is an alternative method. The byproducts of that alternative method can affect your heart. Okay, so that's just one way. Now, if you have a problem with blood returning to the heart, and what happened is the blood flow that's coming back to the heart cannot get to the heart, then the amount of blood that's to the heart to come back is not enough, and not sufficiently, and so it all is caught up in the legs and in the pelvis. It doesn't get to the heart. So these are kind of some of the things that affect. And so what it does is cause your heart to beat more, and because your heart beating more, it requires more stress, and the more stress you give the heart, the harder it have to work, and more likely you can end up with a heart attack or something from overworked heart.
Okay. Okay, thank you.
Sister Janice Coakley, was that Janice Coakley who just spoke? I also see a hand from Edith Roach.
No.
Sister Edith Roach, do you have a question?
Are you able to hear me?
Yes, we can. Go ahead.
Thank you. Good evening, Dr. Farquharson. Very informative presentation.
Good evening.
The only medication that I am on is high blood pressure medication, 10 milligrams, and I tried twice to come off of them. I try to eat right and exercise. Actually, I listened to your presentation while on my walk. I walk daily, Monday through Friday. Even during the lockdown and all of that, whenever I was able to, I did. But I don't seem to be able to come off of that medication. And I don't believe in taking anything for the rest of my life. Any medication, what can I do?
Oh boy. Well, the problem, Ms. Roach, is the high blood pressure already has an effect on your end organ, right? On your organs.
Yes, okay.
And so because of that, to reverse what already happened to the organ is where the challenge is. Mm-hmm. Okay?
Yes.
On top of that, you have age.
Yes.
You have gender.
Okay.
Your family that you didn't choose.
Okay.
You have the environment. You have all the stress that goes on with existing. And so you have other things that come into play that makes it much more difficult to just come off your medication. What I suggest is you have a good discussion with your physician, and you work to try and reduce it as much as possible to a point where it is tolerable, right? So coming off may be a challenge, but certainly reducing it may be easier than trying to, because the amount of time it takes to reverse, it might be longer than life itself.
Okay, so 10 milligrams can be lowered.
I'm sure it can be. That's what I say, and that's a discussion you need to have with your physician.
Okay, thank you very much.
Okay, you're welcome.
All right, so thank you. This is our after show, if you would call it. We do want to thank Dr. Farquharson for answering our questions. We are wrapping up in exactly 1 minute. So if there is one more burning question out there you would like to ask before we close the meeting, you may do so. Otherwise, we would like to say a pleasant good night to all and let you know that our Monday night lecture series, as it says, Monday nights continues every Monday night through October. The first Monday of the month, our public lecture focuses on backyard farming. The second Monday in the month is health and wellness. And so this is the second Monday, hence the health and wellness focus for tonight's lecture. The third Monday is spiritual enrichment. And so we focus on some topic from the scripture that will help to enrich us. Next week, our own pastor, Pastor T. Basil Sturp, will present on ceremonial Sabbaths versus the seventh-day Sabbath. What does the Bible say about those? And then the fourth Monday, we have financial education. And so for the month of June, we will have a representative from the central bank speaking on the sand dollar digital currency, as well as the elimination of the 1 cent coin from our Bahamian currency. And so please, as you are able, continue to join us each Monday night. And we pray that you will continue to be enriched and blessed, and that your soul will prosper and you will prosper in every other area of your life. Good evening.
Thank you, Basi.
Thank you very much, Marcia.
Good evening, all. Wonderful presentation. I enjoyed it immensely.